Welcome to the program. I'm your host, Neil Howard. Thank you for joining us once again here on Health Professional Radio. In this segment, we're going to have a conversation with Dr. Cedric Bryant. He's Chief Scientific Officer at the American Council on Exercise, and he's joining us to talk about ACE's behavior change research-based philosophy called the Mover Method. Thanks for joining us here on Health Professional Radio, Dr. Bryant.
My pleasure, Neil. Thanks for having me.
What is your area of expertise?
Sure. I have a Ph.D. in physiology by training, and I have spent my career in the health and fitness space, educating and training exercise professionals, from personal trainers, group fitness instructors, health coaches, to be able to help individuals make important lifestyle behavior changes to help reduce their risk and susceptibility for a variety of chronic conditions, and really to help those individuals become members of the healthcare team. Because I think optimal healthcare is really delivered in a team approach where you have many different players, and exercise professionals and health coaches are part of that team of helping connect the clinic to the community, if you will, in terms of being able to help people make these important lifestyle behavior changes that we know help to reduce their risk of virtually every kind of significant chronic condition that you can think of, from obesity to diabetes to coronary heart disease, hypertension, et cetera. And so it really is just an important, I think, role that our professionals get to play.
No, we're talking far, far above and beyond simply walking around the block every day as a lifestyle change. When you're talking about exercising, you're talking about everything that you are going to be doing as a person with or without any chronic condition at all. You're talking about their nutrition. You're going to talk about their doctor's visits. You're going to talk about everything, because all of that is involved when you're trying to exercise or start to exercise. Is that correct?
That is absolutely correct. All those things influence the outcomes that one's going to experience, because it really is about a lifestyle, and it's not just one particular aspect or dimension of that lifestyle. And that's our mission is to get people moving, and I think people oftentimes don't fully understand what we mean by get people moving because of our name being the American Council on Exercise. People think of the focus as being exclusively on physical activity or exercise, and it's not that. It's really getting people moving toward adopting and maintaining healthy lifestyle behaviors. And as you mentioned, those things include nutrition, it includes your sleep habits, it includes effectively managing stress, avoiding unhealthy substances. So it's a wide variety of lifestyle factors that we know are key influences over one's health profile.
Before we talk about the Mover Method, let's talk about a couple of the misconceptions about exercise that seem to keep people stagnant in their thinking when it comes to exercise.
Sure. I would say one of among the larger misconceptions is that I think people have kind of this all or none mentality, is that if I can't get what they consider a real workout where I'm really just heavily perspiring and breathing heavily and so forth, that it's not worth the effort. And it really, every little bit of activity matters. It's like loose change in your pocket. It all adds up to real money and benefit. And so what I always tell people to do is, to do some activity, because some is better than none, but more is better than some. Mm-hmm. And so it's really kind of starting where you are, because there's a physiological tenet called the law of initial value. Mm-hmm. And what that basically states is that the further you are from your true genetic capabilities or potential, any small dose is going to elicit a pretty favorable response. So for that person who is that proverbial couch potato, anything he or she can do to move more is going to be beneficial. And we see this reflected in some of the guidelines that many of your kind of health agencies and organizations have been making recently. Like, for example, the American Diabetes Association just made a recommendation that individuals impacted by diabetes, that just little short bursts of activity can be helpful in helping them to better control their blood glucose levels. And so all movement counts, I think, is one of the things that I wish that people could understand.
The American Council on Exercise's mover method. What is the mover method? I mean, we've been talking about changing people's mindsets as it relates to movement and exercise. What is this research-based philosophy?
Sure. Well, the mover method came about in that one of the things that we noticed is that if you were to survey 10 folks and you ask them, do they think exercise is important and helpful and beneficial, at least 9, probably all 10 of those folks would say yes. But if I were to ask those same folks another question in terms of how regularly are you moving or participating in physical activity, only about 2 of those 10 would say I'm doing it on a regular basis. So what's the disconnect between knowing what to do and actually doing it? And that's where behavior change science and lifestyle behavior change come into focus is how can we help individuals who know they should be moving, many of whom want to move, but they just can't seem to overcome that inertia to get themselves moving. And that's where the mover method comes in. The mover method is really a client-centered or person-centered approach to get people to really become empowered and believe in their abilities to actually make that change of going from a non-exerciser to an exerciser. And it's really, based upon some very, basic tenets in terms of, first, you need to understand where the person is and kind of what's their why. And so it starts by, we refer to it as the ABC approach. It starts by asking open-ended questions. So ask questions to try to understand what are the things that are important and valuable to that person? What have been their experiences? And then the B is kind of breaking down barriers. Ask probing questions to discover, what potential obstacles may get in the way of the client making that change to be more active or to eat more healthfully. And then the last one is once you understand what are the important motivators for the person, what have been the barriers or challenges that they've experienced, the C is collaborating, working in collaboration with that person to develop a game plan and establish goals to establish those specific actions that you're going to partner with them in moving toward establishing these progressive incremental goals. And because the reality is that the person who is the foremost expert on that client's life is that individual. And so that's the approach to that ABC approach.
Talk about the fear of moving. I mean, we're living with this COVID-19 pandemic that's not going anywhere anytime soon. Does moving require being around other people? Does it require that you disregard social distancing and any of the other guidelines that the CDC is recommending that we do to keep ourselves safe?
Not at all. And that is the beauty, is that movement can be done anywhere. Because with technology, you have the ability to stream and watch any type of workout that you want to receive and participate in. And being outdoors and maintaining social distancing is probably the safest form of activity that you can get, kind of during this current environment. So, find things that you enjoy and experiment and explore. And the thing about it is that if it's dancing, if it's hiking, if it's running, if it's playing tennis, all those things are good, viable options. And it's really kind of finding that form of movement that you're going to find enjoyable, because one of the things the research is very clear on is finding activities that we deem as having value and that we enjoy are activities that we're going to adopt and maintain, and that's the real key.
Doctor, we'd like to learn more online about the mover method. Where can we get some more information?
You can obtain more information at our website, which is acefitness.org.
Well, Dr. Cedric Bryant, I appreciate you joining us here on Health Professional Radio.
Thank you, and thanks for what you do, Neil. I really appreciate the service you provide to consumers.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.